Millions of women suffer from a painful menopause symptom they're just too embarrassed to discuss. It's a symptom that can mess with their daily comfort, their confidence, and even their closest relationships. The numbers are staggering. Studies show that it affects anywhere from about half to as many as 84% of postmenopausal women, yet so many suffer in silence, believing it's just a normal, unavoidable part of aging they have to put up with. But I'm here to tell you, that's just not true. Today, we're going to pull this hidden symptom out of the shadows. We're going to talk about vaginal dryness. We'll get into exactly why it happens, and most importantly, we're going to talk about how to fix it. Because you don't have to live with the discomfort and you absolutely deserve to feel like yourself again. Section 1. The problem, more than just a little dryness. So, let's get crystal clear on what we're talking about. While we often call it vaginal dryness, the medical community now uses a much better term. Genitourinary syndrome of menopause, or GSM. I know, it's a mouthful, but the name change is a big deal because it recognizes this is not just some minor inconvenience. GSM is a whole collection of symptoms caused by the drop in estrogen that affects not just the vagina, but also the labia, bladder, and urethra. So what does that actually feel like? It's not just a lack of lubrication during intimacy. For many women, it's a constant, daily feeling of soreness, burning, or itching. It can be pain just from sitting too long, wearing your favorite jeans, or even from exercising. It can also show up as urinary issues, like feeling a constant urge to pee or getting recurrent urinary tract infections, or UTIs, that seem to pop up out of nowhere. And of course, it has a huge impact on sexual health. When the vaginal walls become thin, dry, and less elastic, sex can become incredibly painful, a condition called dyspareunia. This can lead to bleeding or tearing during intercourse, and, understandably, a loss of interest in sex altogether. It's a topic so personal, so intimate, that it can strain relationships and crush a woman's self-esteem and quality of life. The real tragedy here is the silence. It's fueled by embarrassment and the wrong idea that this is just what getting older feels like. I recently read about the actress Halle Berry, who shared that when she first experienced this, even her doctor initially misdiagnosed her. It just shows the massive gap in education out there, for both patients and doctors. So, why does this happen? The root cause is the decline in estrogen. Estrogen is like the master fertilizer for your vaginal tissues. It keeps the lining thick, elastic, and well lubricated. I often use an analogy to help my patients really get it. Think of a healthy, estrogen-rich vaginal wall like a thick, plush, deeply wrinkled athletic sock. It's spongy, resilient, and full of folds that hold moisture. Now, imagine that same sock being replaced by a thin, delicate nylon stocking. It's smooth, fragile, and has zero capacity to hold moisture. That's pretty much what happens to the vaginal tissue without estrogen. The walls thin out, blood flow decreases, and the natural acidity of the vagina changes, which makes you more prone to irritation and infections. This is a physiological change, and it is not your fault. But understanding it is the first step toward fixing it. And unlike many other menopause symptoms that might fade over time, GSM tends to stick around and can even get worse if it's not treated. The good news? It's one of the most treatable symptoms of menopause. Don't forget to watch the next part of this video. There are some solutions I'll share. Thank you for watching.